In my job as a psychotherapist, specializing in working with people who've experienced trauma, I have lost count of the amount of people I have helped who have been struggling with nightmares. When we talked about trauma symptoms in my previous videos, one of the main components is that idea of reliving or re experiencing the traumatic event. And one way that can happen is through nightmares. And not only is that distressing within itself, but it also has an impact on sleep quality. And that then has an impact on your overall mental health and your overall quality of life. And nightmares don't have to just come from traumatic events. They can be also what is known as idiopathic, which just means that they have no known cause, but they are still as distressing. I'm going to share with you today a technique that has been shown to reduce how often nightmares occur, can lessen the distress when they do occur, and can improve your quality of sleep. This technique is called Imagery Rehearsal Therapy, or IRT, and it is an evidence-based form of cognitive behavior therapy. So let's talk about what you're going to do to apply this, and then at the end, I'll give you some step-by-step instructions. So you have this nightmare that keeps coming up. That's the one we're going to work with. If your nightmare changes each time, then choose a recent one that you can remember quite well. What you're going to do is write down the nightmare. Okay, this can be in a notebook, it can be on an A4 pad, it can be in a Word document, it doesn't matter. But you're going to write it down in as much detail as you can remember using the present tense. And when you do this, think about the senses here as a guide. So write down what you can see, write down what you can hear, write down what you can smell, taste and touch. And also write down what you are feeling and what you are thinking as the nightmare happens, as the nightmare progresses. So you're describing it in as much detail as you can, and remember, in the first person and in the present tense. So that might look like something like this. I am walking through a forest. It is nighttime and I can hear rustling sounds all around me. I hear a stick break behind me. I think someone could be following me, but I turn around and I can't see anyone. I'm starting to feel really scared. I can feel my heartbeat beginning to race inside my chest, and I start walking quicker. That's just to give you an idea of what we mean by present tense and in the first person. So we're using I words and we're describing it as if it is happening in the now. You're not saying, in my dream, I did this. In my dream, that happened. And if you're working with a therapist, then you can take your written nightmare to a session with them and go through it. You can read it out to them and almost experience the nightmare content in the session. And as you do this, the therapist can help you respond appropriately to any distress that comes up or any difficult thoughts, feelings, or physical symptoms. Usually this would be through some breathing exercises, through some acceptance exercises or grounding exercises. Anything you would usually use to work with difficult thoughts and feelings that are coming up for you. If you aren't working with a therapist, then there is still some benefit in writing the nightmare down, and there can be some benefit in engaging with it, in reading it. If you are going to do this and it is a particularly distressing nightmare you are working with, then please have some form of grounding exercise that you have practiced in place for you to use if required. I've got quite a few videos on my channel now that can show you some ways to do this, and I'll leave a link to them in the description below. If you don't think you can keep yourself safe, if you think you are at risk of dissociation and you struggle to come back to the present, then please seek help with this from an appropriate practitioner. Okay, so you are exposing yourself to the content of the nightmare whilst you are awake, and you are responding flexibly to any of the difficult thoughts or emotions that are coming up for you. Next, you are going to change something that happens in the nightmare. So this change can be whatever you want. It could be a really big change, like if the ending is really sad or scary, then maybe you can change it to something happier or funnier or something that isn't as scary. Or the change could be relatively small. It could be a change in the weather of your nightmare. It could be a change in what you are wearing. It is completely up to you. And other ways you might make a change include coming up with an alternate ending in any way that you want. It could be a very minor change, or it could be a highly imaginative change to the ending. So change the ending in some way. You could insert reminders into the dream that prompt different ways of viewing events that are taking place, such as placing meaningful objects into a scene that remind you that you survived the events, or having other people present in the dream to remind you of other ways you have learned to deal with or think about what happened. You can try transforming threatening objects into harmless ones. Perhaps you can summon other people to act as heroes, to help you overcome a problem, or to protect you, or to help you fight a villain. And try to have this change as an active change. So something you do, not something passive like running away or hiding somewhere from the threat. You then write down this changed version of the nightmare, and again in as much detail as possible. So this is similar to the first time you wrote down the nightmare, but this time it is with the added change or changes that you have made. Now, just before you go to bed, you read this version, the changed version. And as you read it, try to experience it as much as you can. Try to really imagine being there and experiencing what you have written. And when you have done that, practice some form of grounding or mindfulness or relaxation. And then go to bed. Try to go to sleep. If you wake up during the night because you've had a nightmare, I want you to do this. Firstly, a grounding exercise. And this could be any of the ones from my channel, or dropping anchor if you practice ACT and you know that one, or any other grounding exercise that you know. It doesn't matter. Secondly, replay the nightmare in your head with the changed detail. Thirdly, go back to bed. Try to go back to sleep. Okay, so to summarize these steps so far. Step 1, start practicing some form of grounding, relaxation, or mindfulness practice each night before going to bed. Step 2, choose a recurring nightmare you would like to work with. Step 3, write down your target nightmare with as many details as possible in the present, in the first person, and include any thoughts, feelings, and anything you can see, hear, touch, taste, or smell in that description. Step 4, choose a change you would like to make. Step 5, write down the full nightmare with the change. Step 6, practice rehearsal of the changed nightmare by reading through the script and visualizing the entire dream with the change each night, and then practice a relaxation, grounding, or mindfulness technique. And that's it. Those are the steps. And in terms of timescales, then everyone's experience is obviously different, but the evidence base suggests that people who practice this regularly for about 2 to 4 weeks experience the best results. So that's every night for 2 to 4 weeks. And there we have it. If you have any experience of IRT, if you've been through this perhaps yourself or with a therapist, then please let us know how you got on with it in the comments below. If you have any other ideas, any other suggestions to help people who are experiencing nightmares, then again, let us know what has been helpful for you. I'm sure that'll be much appreciated by viewers of the channel or people watching this video. I really do hope this helped someone out there. If it does, then check back in 4 weeks or so and let us know how you got on. Thank you very much, everyone. Thanks for watching. Take care. Goodbye.